Hello, class. Now we are moving to chapter 3, which main focus on chapter 3 is epidemiology, the study of disease, injury, and death in the community. So more or less this is those people that are really good at this are really enjoying this aspect of public health. This is one of the pillars of public health, trying to study diseases, the origin of diseases, where are these diseases located, what are the people or the group that are affected by this disease or injuries, what are the root cause of these injuries. We've seen a lot of advances being made in the cars that we drive and some of the rules that we have in place to make sure that death or injuries caused by accidents are reduced. Injuries in the workplace. Again, epidemiologists go there, study, find out, come up with recommendations. And now most workplaces are safe because, as with anything, you cannot solve a problem if you don't know what the problem is or what causes the problem. So that's why in this branch of epidemiology, it's very, very important for public health. But public health has advanced the overall quality of mankind. They have spent time to investigate diseases at various parts. And one thing that you're going to experience in this chapter, there will be a lot of definitions. Please don't ignore those definitions because they can help you make sense of, at times when you hear some talking heads on the news, you know what they are talking about, or at times, this is not really what is going on. So it makes you a well-informed individual. You can use or consume news in a much better way when you know what is being discussed. Now, after studying this chapter, you will be able to define terms. As I said, there will be a lot of definitions here. So make sure that you take time to understand those definitions. You have epidemic, endemic, pandemic. You've been hearing a lot of pandemic lately. And at times, I don't know if you hear about epidemiology and epidemiologist. And as we go through, we will define each of these terminologies so that you have a functioning knowledge. A functioning knowledge that is going to help you understand public health data to a great extent and explain their importance in community and public health. What is the importance of epidemic? What is endemic? What is pandemic? And what is epidemiology and epidemiologist? These are terms that you should be able to know by the end of the chapter. List some diseases that cause epidemics. in the past and some that are causing endemic today. Discuss how the practice of epidemiology has changed since the days of Benjamin Rush and John Snow. Explain why rates are important in epidemiology and list some of the commonly used rates. Define incidence and prevalence rates and provide example of each. See, as I said, these are all definitions and also things that are used that you should be able to at least have a functioning knowledge of some of these things. Again, discuss the importance of disease reporting to our community's health, and describe the reporting process. Define the following standardized measurement of health status. Talk of life expectancy, years of potential life lost, disability adjusted life years, and health adjusted life expectancy. See, these are all data that is very, very important for government as they plan. Because depending on when people do not live to their life expectancy, then the government has to do something so that they are able, so that you don't fall into the realm of years of potential lost. If the life expectancy is if the life expectancy is 78, anybody dying less than 78 years of old, those years that are lost are the lives that the years of potential life lost. Say if somebody at 78 and they die at 70, years of potential life lost will be 8 years. So you can do now the math for the rest. People dying in their 60s, years of life lost, it will be 18 years. See, this is the average. At times, some people live way beyond that. As you can see, some people live up to 100. But a good number, the average, these are all about averages. Identify sources of secondary data used by epidemiologists, community health workers, and health officers, and list the type of data available from each source. Describe the two main types of epidemiological studies. List the criteria used to evaluate whether or not a risk factor causes a disease. Introduction. Epidemiology is more or less population medicine. Here, we are not really defining what epidemiology is, but its focus is in population medicine. Most of the time in some books, is the frequency of disease within a certain population. Is the study, they investigate. And also the focus of the epidemiology most of the time is population health, disease within the population, the frequency of disease within a population. The epidemiologist concerned with cause of disease in a population. The epidemiologist is the one who investigates the disease. Where is this disease from? How is this disease transmitted? Who are the people affected by this disease? And in some cases, is this a disease that has already been studied? Because most of the time, certain things, there's a lot of information already within the medical world. If it's a disease that has already been studied and they know the cure, then they prescribe the cure for it. Like some infectious diseases, they already know the cause and how to treat it. Collect information about disease status of a community. How many people are sick? Who is sick? When did they become sick? Where do they live? See, these are some of the main questions that they are asking. Whenever something happens, people from CDC, the Centers of Disease Control and Prevention, that is housed in Atlanta, send experts to the area to investigate the root cause of the disease. How many people are infected or have been sick? Who is sick? Is it male, female, children, elderly, blacks, white? See, you have to find out who is sick. When did they become sick? You have to know the timeline so that they can go back and find out what happened at that time and what made them sick. So, for instance, in some areas wherein there is an outbreak of certain bacterial infection, they can be able to do the timeline. When was that outbreak? So that then they can be able to find out, or where do they live? They need to have that information to help them. What are the conditions within where they live that made it conducive for either that pathogen or the air or the water that they drink could have been the root cause. So most of the time when there is an illness, people don't just make the assumption. They come to the place and investigate so that they know the root cause, who is impacted by it, who is ill, who is sick, and they can be able to find out how they can be able to treat that situation. Data can be used to prevent disease outbreak or determine effectiveness of prevention efforts. Now, data, which means it could be, okay, previous studies or the data that they are collecting at the moment could also help to determine how they can prevent. How many people are sick? Who is sick? Is it children, young people, old people? And when did they become sick? And where do they live? See, where do they live is big when it comes to diseases, especially when it comes to infectious diseases. So that data that will be collected can be used to prevent disease outbreak or determine effectiveness of prevention efforts. Now we go to the definitions. As I said, there are a lot of definitions here in this chapter. So please take your time to understand these definitions. Don't just brush them off, because you should be able to make sense of whenever you hear epidemiology. What does that mean? It's a fancy, sexy word, you know. It's a, well, what does it mean? It's the study of distribution and determinants of health-related states or events in specified population. It's the study of distribution. How is this distributed within a population? And a determinant of either the environment, what contribution, whenever we use the determinants of health, remember, you have the environment, the social, the physical, and yes, the biology also. These are all possible things that contribute. So try to understand whenever you hear the word epidemiology. You see, because right now there is a big study, all the epidemiologists, especially those who know what they are doing, are they are in high demand. Because even though we have tried to really understand certain aspects of the coronavirus, there are still some areas once in a while, you know, it's some nuance, especially now wherein some of this, the coronavirus is mutating, is replicating and then mutating into various strands. So these are the work of epidemiologists to be able to identify those various strands. Now you hear, oh, the South African strand and the West African variant is much more aggressive and it kills. Then you hear the Brazilian variant. Then you have some that are variants from various parts of our country, like LA, California. Say because the longer this virus stays within the population, the higher it has the possibility to replicate and mutate into another variant. So that's why it's very, very urgent for us to do all that can be done to help the epidemiologist to get rid of this virus so that we don't continue passing it from one person to another. You make sure you always use your mask. You keep that distance, 6 feet distance from somebody that's not part of your close knit relative, somebody that you've lived with. That's really, because even with relative, if they are from different place and they are visiting, the 6 feet is still needed. I'm talking about somebody from your household. That's it. But if somebody is visiting from another state and this, they can be relative, but they are coming from somewhere and they can be bringing the virus with them. So you make sure until, especially those initial days that they are around, everybody puts on a mask. You wash your hands, you avoid crowds. Okay, then the next terminology here is epidemic. Unexpectedly large number of cases of an illness, specific health-related behavior, or event in a particular population. Now, there are certain things that we are saying now is especially when you think of obesity. Obesity is becoming an epidemic because you have a good number of people within certain parts of the country that are just becoming overweight, and some of them morbidly overweight. And at times, there's a specific behavior that contributes to that. Inactivity and eating food loaded with fat and too much of it. And at times, there can also be an outbreak of certain infectious diseases, especially during the fall. There are certain diseases that people experience it, the flu. And most of the time, again, with certain behaviors, people don't wash their hands. People treat their mouths and noses without really washing, keeping them clean. People living in close quarters. All of this can be issues that can contribute to an epidemic situation. Every now and then you hear there is an outbreak of certain problem or diseases in certain areas. Most of the time, once they know about the outbreak, the epidemiologists come in and find out what is the cause. In some cases, they come up with ways to address the situation. You have the endemic. Endemic, this disease that occurs regularly in a population as a matter of course. Now, usually in the fall, people are expected to take the flu vaccine, especially when they are at certain age. And so the flu is usually can be endemic. People already know about it. that come fall, people are advised to take, especially people of certain age or with certain health conditions, they are advised to take the flu vaccination to prevent them from being sick. So endemic is a regular, something that is regular. It's not okay. One time is gone, the other, there is it occurs regularly at certain time of the year. Then you have pandemic, as we are now dealing with the COVID. Pandemic is an outbreak over a wide geographic area. See, the wide geographic area across countries. But this pandemic is all over the world. There is the COVID virus of one form or the other and causing havoc, causing so much pain, causing so much misery, and causing so much death. And in the process of trying to reduce its spread, jobs are lost, school closed, education, the mode is changed from online, from in-class face-to-face to online. And most of the time, for some people, it's just a poor fit. Having online classes at home for some people is just a disaster because either the Wi-Fi or the band connection is not there, or they don't have a computer that can really function, or the environment is just not conducive. Sharing a crowded place and trying to take online classes, the amount of interruption is enough for some students not to do well. So again, one way that this can be solved is for everybody to do whatever they can to prevent the further spread of this disease so that we can go back to our classes, so that we can spend times with our students, our faculty members, and really have the opportunity to interact face to face so that you have the possibility to ask questions in a timely manner to enhance the learning process. Now, the history of epidemiology. The concept data backs to the Hippocratic period, say 300 BC, way there. Few advances made all fall. Few advances made after fall of classical civilization of Greece and Rome. Subsequent waves of infectious diseases or disease epidemics. You have the plague, you have the yellow fever, you have cholera. See, at the fall of the civilizations of, say, Greece and Rome, there was a big waves of some of these epidemics, diseases occurring in certain populations. causing a lot of destruction, killing a lot of people. And the yellow fever, depending on what country, you still have some of those with some of those diseases. Cholera, especially in poor countries wherein drinking water is is polluted with feces, can give rise to cholera. So yeah, some of these bugs, some of these pathogens have been with us for a long time. The advanced countries have, to a great extent, eliminated some of these diseases in their respective countries. But developing countries, in some cases, some of these diseases still show up. And because of easy communication, because of global movement, some of those diseases that were once considered eradicated in some developed countries, things like TB, cholera, once in a while they show up in advanced countries because people traveling from poor countries at times come with these diseases and pass that disease to some other and to other people within the developed countries. So that's why, again, there is a group of epidemiologists that are really very, very, they watch out for some of these things. So that because the medicines, the treatment is already there. It's just for the appropriate medic intervention to be applied. And that's why also, as we are talking about the coronavirus, that virus will only be eradicated when it is eradicated all over the world. If if we think, okay, eradicating the disease in America is enough, then I think we might be drinking some Kool-Aid, because somebody traveling from other parts of the world, if they have the infection, it's very easy for them to transmit the infection. And again, Americans like to travel, go to places, get infected, and bring the disease home. So examples of how epidemiological methods can be used to limit disease and death, according to John Snow. Now, rates are most of the time, divided by, it's a simple mathematical formula. They allow Rates allow for comparison of outbreaks at different times or in different places. Now you have cases. Cases are the number of people affected, those who are sick by the infection. Now, rates is the number of events in a given population over a given period of time or given point in time. So you're talking about the natality rate, morbidity rate for sicknesses, mortality rate, fatality rates. These are number of kids who die, say, within 1 year, divided by 1 year. People who are sick, number of people, number of X divided by 1 year, times the time. Population at risk, those susceptible to particular disease or conditions. Now you have the definitions here and the formula. When you talk about the incidence rate, it's the number of new health related events or cases of disease divided by the number of people exposed to risk during that period, multiplied by 100. So simple. The number of people affected during the epidemic divided by the number of people exposed multiplied by 100. Usually that's the rate. You have the incidence, the prevalence, and the attack rate. Incidence rate is the number of new health-related events or cases of a disease divided by the population at risk. Importance and study of acute diseases. Diseases in which the peak of severity of symptoms occur and subsidize within days or weeks. Certain acute diseases, they really spike, and later on the symptoms more or less disappears. At times, when you're thinking of fever, you hear people acute fever, you have when there's the disease activities, there's a peak of the symptoms, and later on they fade away. Especially those so even with the flu, you have a time wherein the incidence of the diseases, there's a period wherein it's very high, and later on it just fizzles away. Attack rate, incidence rate calculated for a particular population for a single disease outbreak, expressed as a percentage. That is times 10 times 100. Prevalence rate is the number of new and old cases in a given period of time divided by the total number of the population. useful in study of chronic diseases or chronic diseases that usually last 3 months or longer. When you talk of chronic diseases, the symptoms last for about 3 months or longer. Now, incidence, prevalence, and attack rate. Now, look at the table here. Try as best as possible to understand some of these definitions of rate. Number of new health-related events or cases of disease divided by number of people exposed to the risk and to risks during the period. Now, attack rate, the cumulative incidence of infection in a given group during an epidemic, divided by the number of people exposed. Because most of the time you also have to bear in mind, it's not everybody that is exposed that will fall victim. That's just life. Some people are exposed and it's just even with this, the virus. Some people have mild reactions and after a week or so, everything disappears. While some people have very serious and others die of the disease. So most of the time, some of these things are not as easy to us to explain. Now you have the interpretation of rate. Now, again, now we're talking about mathematical concepts here. Incidence prevalence rate expressed as crude or specific. Crude rate, a rate in which the denominator include the total population. See, crude rate, the denominator include the total population. Age adjusted rate used to make comparison of relative risk across a group and over time when group differ in age structure.